Good morning, everyone. This is Mike Quaranta, and I'm president of the Delaware State Chamber of Commerce, and welcome to our webinar this morning titled Childcare in a Post-COVID World. We've seen some very challenging information that's become public, in part from one of our speakers and presenters today that suggests potential of 1/3 of all childcare businesses across the United States perhaps not reopening, and the implications of that for employers and their employees is quite substantial. And so we wanted to dedicate some time to this topic today and bring in some folks who we think can provide some insights and ideas. Before we get going on the actual subject matter today, let me talk about a virtual conference that we've got scheduled coming up in July. This is a combination of a couple things that we have typically done in the past. It was our manufacturing brunch that got postponed in the middle of March for obvious reasons, and our end of session brunch, which we typically do about this time of year in Dover, that's been set aside as well for obvious reasons. The General Assembly is going to meet in a very abbreviated time frame later this year. So what we really thought was critical was to kind of bring all of that together, plus some long-term policy ideas that we've put on the table, and invite the governor, legislative leaders, business leaders together to talk about what does economic recovery look like here in our state. And we can't get to this soon enough. We need to put people back to work. There's some strategies that we've offered to the governor and to other policymakers, and we want to talk about those ideas because we believe some of those can get started right away. Others are more distant, but with the goal being, when we look 2 years from now in the rearview mirror, did we take advantage of this moment, not just to focus on the public health challenges facing our state, but also did we put ourselves into a different orbit that might help us economically going forward as well? So that conference, it's going to be a virtual conference. You're going to have to watch it on your computer or download an app. And it's really going to be neat technology. So you can register online, as the slide suggests, at dscc.com. And for those of you that are out there that would like to sponsor, we would certainly welcome that too. So let's get going today. We couldn't do this without our sponsors. So we're grateful that Lisa Peel is with us. Dr. Lisa Peel from Delaware Tech Community College is with us today. She leads their K through 12 partnerships, and we're grateful to all that they do, the efforts that they make to help prepare people to work in the child care space and in so many other different ways around the state. So with that, let me turn it over to Lisa for a few comments about her program. And Lisa, thanks for joining us, and thanks for the sponsorship.
Hi, can you hear me, Mike?
We can hear you. Go ahead. You're live.
Okay, great. So thank you all for the opportunity today. I work with our PK-12 partnerships, as Mike said, which at Delaware Tech, we prepare early childhood folks, but we also work with elementary ed and secondary and all of our institution of higher ed partners to transfer those teachers that want to be certified. I wanted to focus a little bit today on some of the efforts we're making with the emergency childcare sites. So one of the things I think is ironic is how much we've advocated, and advocates for early childcare have been working to convince anybody that will listen, really, policymakers, community leaders, business leaders, that high quality early childhood programming is essential. And we know that it helps remedy societal issues, and it's really key to a thriving economy. And I think this spring we've learned just how essential it is. As the governor issued the executive order to ensure that childcare was available for anyone that was essential and needed to work, providers in the state pivoted to really serve and launch the emergency sites. And at Delaware Tech, we were no different. We exited nearly 300 students from our existing programs to make room. Those that were essential families stayed, of course, and then we brought in a lot of new families of essential workers who had to entrust us with their children, essentially strangers, and they couldn't even walk their children into the building because of the screening and precautions that we were taking. So we're really grateful for the providers and the people that are working on the front line. I've lived through this with them, so I can say they're the true heroes here. We're especially thankful for the enhanced funding that the state provided to allow us to continue to be operational and pay our staff. The margins were thin. They are in early childhood before this, and so I think the topic today is timely. And I hope moving forward that we'll see that we can put the pandemic behind us, but the struggles we face with resuming quality care and ensuring that we have quality care for all children and that it's equitable and helping to help them reach their potential will be something that we all focus on. So again, thank you, and I look forward to hearing the discussion this morning.
Great, thank you, Lisa. And again, we're grateful to Delaware Tech for their sponsorship today. Let me introduce our two speakers today. We have with us, and the first person you'll hear is from Cheryl Oldham. Cheryl is the Vice President of Education Policy at the U.S. Chamber of Commerce, and she's also on the foundation part of the U.S. Chamber. She's a Senior Vice President of Education in the Workforce. And then we're also going to hear later, after Cheryl completes her presentation, from Delaware State Representative Quinn Johnson, who his district is in the Middletown area and coincidentally is in the childcare business. And so he provides a unique set of experiences and insights in that he's both a policymaker and a practitioner. So let's start with Cheryl. Cheryl, welcome. So great of you to join from the Washington, D.C. metro area, and we look forward to your presentation. Take it away.
Thank you, Mike. Thank you all for inviting me here today. I'm so pleased and honored to spend a little bit of time. I've got a few slides that I'll just tick right through. And I think I want to sort of, the frame for these slides is kind of a little bit about the industry and what we're talking about, a little bit about some of the work that we've done at the Chamber Foundation that sort of sets the stage for some of what we're dealing with now. A little bit about what's happening in the time of COVID, and then where do we go from here? So next slide, please. So a little bit about the sector, and Mike, sort of, you've got, an expert in Representative Johnson, direct from Delaware and a provider himself. So I was just going to sort of take it a little bit at the more national level. So a little bit about the sector. What are we talking about nationally? Almost 700,000 childcare businesses, vast majority of them small businesses, employing 1.5 million workers. Most also not on this slide are, women and minority women who run these small businesses. Industry yields almost 50 billion annually. I think really interesting, sort of the breakdown of the kiddos. So almost 50% of all infants birth to one are in childcare. 1 and 2-year-olds, a little bit over 50%, and then 3/4 of 3 and 4-year-olds are in a childcare situation in this country. 2/3 of American families with children under the age of 6 dependent upon childcare. Next slide. I included a little bit of Delaware specifics, but I feel like I should leave that for the expert. But I will say this is some data points gathered from Childcare Aware and from Committee on Economic Development, who has state-by-state data. So a few items, the number of children under the age of 5 in Delaware, and then, pre-COVID, how many slots there were in the state, which is actually, I think Delaware is a place that, appears to have, or did pre-COVID, a pretty good balance of slots available and children who need them, whether they are exactly where they need to be and that's another question for sure. Also predominantly centers as opposed to, I guess, fewer in the sort of family childcare provider space. Next slide. This is where I wanted to share just a little bit about what we had done in this space pre-COVID, because I think it's really sort of telling about the industry and sort of challenges that we had before we had this global pandemic. And so we at the Chamber Foundation, which is an affiliate of the U.S. Chamber, and does more programmatic work. And we had done some, for about the past 4 or 5 years, had been working in this space of childcare, really trying to make the business case for why this is not only a very important work support, but also a really critical, sort of educational foundation. So quality, access to quality childcare, just critical for kiddos. And, as I said before, we can see the number of children 5 and under who are accessing childcare, so that sort of quality piece really important. And we knew we had a challenge. So we dug a little bit into kind of the economic impact of childcare and what happens when it's not available to working parents, and what does it mean for a state's economy? What does it mean for economic impact to employers as well? And so we worked in 4 states. Delaware was not one of them, but I just wanted to share just a little bit of the numbers because I think it's telling. In places like Pennsylvania, $3.5 billion lost annually, almost $3 billion to employers annually. So when childcare is not available, are there breakdowns, or parents, can't, have to step out of work in order to care for kids? This is what the cost ends up being. Next slide. And then, then COVID hit, right? And it really has decimated this industry, as you all know well. And early surveys that were done by NAEYC with the sector directly were showing that a third didn't expect, this was early on, didn't expect to survive a shutdown that was going to go longer than a month. Half of childcare providers have ended up closing, and many are feared not able to return. About 4.5 million childcare slots potentially lost permanently across the country as a result. So when you think about that sort of comparison pre-COVID, the economic impact of not having quality childcare pre-COVID, and then the impact of the pandemic, we see how sort of dire the situation is. Next slide, please. And again, a little bit on Delaware specifically. It's sort of, at least through the research that I did, appears that you all were in phase 1. Centers open and homes open for those designated emergency childcare, and then phase 2 reopening a little bit with group size limitations. And then a little bit on sort of, there was an earlier CARES Act that Congress, one of the stimulus packages that came probably, I don't know, time is a little bit of a, has sort of lost us these days, but I think it's probably around, I don't know, 6 weeks ago now that the CARES Act was passed, the $2 to $3 trillion package, and there was a significant boost in the Child Care and Development Block Grant funding. Delaware received, close to $10 million, and a few of the ways that money is, being spent to support essential personnel by waiving those parent co-pays for childcare, supporting all subsidized providers by continuing to reimburse them regardless of whether children attend, obviously important so that they can continue to exist, and then reimbursing providers whether they're open or closed. So let's go to the next slide. Additionally, in addition to that sort of plus up for the Child Care Development Block Grant, which is really kind of the core federal investment in childcare. There was additional, $30+ billion in the state fiscal stabilization funds, early childcare education programs and services, and allowable use under that fund, but that would be a state-by-state decision. $750 million plus up for Head Start, and then there was some small business support through the Paycheck Protection Program and the Economic Injury Disaster Loan Program through the Small Business Administration. I think it's important to note that I think that, I don't know the statistics for Delaware, and I'm not sure that anyone, I don't believe that the federal government is tracking this, but we do know from survey data that the access to the Paycheck Protection Program by small businesses in the childcare sector was not great. So we're not, I think fear that maybe that program didn't give small business childcare providers maybe the support that they, were entitled to or needed. Next slide. So what does return to work mean really for the providers, right? So we think about shifting to reopening and, thousands of centers are closed and classrooms and homes and sort of having to kind of turn that switch on. And it's not certainly as easy as just, being closed and then opening the next day. There's certainly a tremendous amount of extra and unplanned costs that we anticipate any center or home will have in just trying to reopen. Training for workers around health and safety requirements. Again, and then once centers are open for beyond that, just emergency personnel is social distancing requirements, and so operating at a reduced capacity. And it's we know that this is a sector that you don't go into childcare to make $1 million. This is a sector that operates on very slim margins already, and so those increased costs are really going to be challenging. Next slide. And so what is Congress thinking about right now? There's some tick through a few things here that have been introduced. I think this is beginning to be elevated as a priority issue. And thanks to, Delaware signed on to a coalition letter that was sent up to Congress yesterday. 41 of the 50 state chambers across the country signed on to say this is a priority and we need to see support for this industry. So I think that's getting attention. And we had, the HEROES Act, which was the Pelosi bill on the House side, had $7 billion additional for CCDBG. We've had some senators, Ernst and Loeffler, propose up to $25 billion in plus up of CCDBG. And then we had most recently Senator Murray and Representatives DeLauro and Scott introduce a Child Care as Essential Act that's $50 billion in Child Care Stabilization Fund within the CCDBG. So lots of different numbers floating out there and lots of, everything from $7 billion to $50 billion. So I know that the sector is very interested in, it's important that CCDBG get additional funds, but how do we also have a piece of that targeted directly to providers to really help them with those items that I mentioned earlier, the costs that they all will incur just to reopen and to have to, comply with all of these really important health and safety requirements and operate on, at less than capacity. Next slide. And then the one thing I just wanted to end with is to say we are in the field right now at the Chamber Foundation with new parent surveys and employer surveys and really trying to model the economic impact of this pandemic. And so we would love it if Delaware wanted to play a part in any way in that activity to really kind of understand how this is impacting parents, how this is impacting employers, and help us to sort of think about how to support the sector going forward with real data from the field. So I will end there and wait for questions after Representative Johnson. Thanks so much.
Cheryl, that was great. Thank you very much for your presentation. Lots to think about. And let me also mention before we go to Representative Johnson, if we have any members of the media who've joined on today, this is an off-the-record presentation. If anybody's interested in reaching out to Cheryl or to Quinn Johnson, we will certainly help you get in touch. But this is an off-the-record presentation. Let me now turn it over to Quinn Johnson. As I said, Quinn is really has an interesting perspective on all this, being someone who serves in the Delaware General Assembly as a state representative from the 8th District, but also an owner of and a practitioner in the industry, and has been for quite some time. So without any further comments from me, Quinn, the microphone is yours, sir.
Thank you all very much, and I hope everybody can hear me okay and no feedback. Everybody good?
Nope, you're good.
All right. So yeah, thank you very much. Thank for all the participants today. Just a little bit about the background, as Mike stated, I have been in the field actually for quite some time. We actually started out our early child care business back in the early 90s, 1992, actually as an in-home provider where we refinished a garage and had 6 children, and that's where it started. And we've ended up over those 25 years now as a multi-center facility program. And during that time, we've watched and been a part of, what Delaware has done to obviously improve the quality of the care that exists, the different incentive programs that are out there. And I definitely have to agree with the comment Lisa made earlier, which is up until, sadly, COVID, it seems to be that obviously early child care, not only in Delaware, but around the country, has not been, a huge priority, despite all the research that shows how important it is in a child's life, especially early on. And now COVID made it come to light that, yes, we are essential. Yes, we do have a huge impact on the economy, not just in the jobs that we provide, but also from the fact that we have to be there for all the other parents that do work to have a place for their children. And that's why going into the pandemic, it was determined by the administration that we needed to be able to have that essential care, that we needed to have some sort of support within the states to do that. And so I will touch, and I'm going to back up in a second, but I'll touch a little bit now about what we did because of that understanding. Delaware did receive, and Cheryl had showed at least the 9 million plus that was directly provided for early child care in the state of Delaware, but also because of being a small state, we actually benefited by the CARES Act and what funds we actually received to handle COVID-related issues. And so what we did is that we created a program that did allow for programs to apply. They could stay open and obviously serve the essential, knowing that they would have, through the increased restrictions, as well as just the general population staying at home, a very limited attendance amount. And clearly there was no way that that attendance would support the business to stay open and pay staff. So a formula was created that would allow for those to still get paid their purchase of care payment, which is what was in the presentation slide before. That's continued and still continues. And then we took their license capacity and said, okay, you'll have obviously some enrollment, which you'll be getting payment for, but tell us all the other vacant spots, and you'll get a stipend for those vacant spots. The other intent was also for them to continue to pay their staff. Clearly, we saw that the unemployment departments were overwhelmed. That was the other story of what departments have gotten overwhelmed. And we wanted them to try to stay off of the unemployment rolls because we also know that not only are the businesses very limited in their resources because of the rate of pay, sadly, that early child care workers get, we know that they also could not stand having a week or two without pay. So that program has been highly successful in helping the businesses out, especially in Delaware. It's allowed them to get the resources to continue to either remain open, or even if they closed, to still be able to pay their employees. We are entering into next week our phase 2 of the reopening plan. During that period of time, you will see then that the governor is allowing for all individuals to be able to go back if they so choose to. One of the dilemmas that we're sort of dealing with right now is that we all don't have a crystal ball. So none of us know what is the public ready for, meaning is that, are there still going to be parents out there very concerned about the health of their children, and will they avoid, coming back? There are, of course, others that, have been trying the best to not only work from home in this environment of what we're doing today, but you can imagine if both parents are having to try to work online and care for, little ones in the house, it's virtually impossible. They've done their best, but that's going to be allowing them to obviously come back as well. So we're really going to be watching what occurs this next month and to see how many of these facilities come back and obviously provide for that. And what plays into that question though is the question that is here. What did the provider landscape look like in Delaware before? And then what does it look like, obviously post? Prior to this, the early child care industry in Delaware was in what we call a crisis mode. And the reason it was in a crisis mode was because of the staff shortage that we were having. It was great to be able to have a 3.5% unemployment, but what that did was basically make it almost impossible to find qualified teachers to be able to fill the vacant positions that we had. And it was really getting stressful for providers to be able to try to manage it. We had lots of times where we tried to have testimony down in Dover, and providers just couldn't make it because they just could not leave because of the employment shortage. Sadly, some of those individuals that were having such a hard time probably are going to say, you know what, this was the last straw, and the stress of everything is just too much, and I just can't continue in this field because obviously the margins are so low. On the flip side, because the unemployment rate after this is definitely unfortunately going to be higher, we may see that then more people are looking for that job. The reason that we have some of these issues and why it's a problem is because of the past support that the states and the federal government, and this isn't just for Delaware, but have provided to the early child care industry. And so what I want to do is sort of back up, and I will say, because I'm in this field and see what's happening on a day-to-day basis, a lot of the policies that get put in are always great intentions, but not always are understood as to how they will actually impact the business side of things. And so as we've pushed through these last several decades of improving quality to have better outcomes in school, there's been a lot of added restrictions, there's been a lot of reduction in the capacity, and all of that has had a direct impact on the price that's charged for early child care. So much so that it's a situation that clearly young families have a difficult time trying to even afford. And the statistics now show that actually they're paying the equivalent of a college education for an infant now around the area. And sadly, though, what people don't understand, they always ask, well, why is it that then still the early childhood providers / employees still are making what they're making? Well, the problem is because of the child to teacher ratios that you need to have, the number of individuals, because most parents obviously need to go to work and work, at least an 8-hour day. But of course, to get back and forth to the site, they're usually, a child is in care on average 9.5 hours. Well, that means you now have to have yet another employee come in to care for that child. In addition, the regulations have required to where, if you have 2 teachers in a classroom, they cannot leave that child out of ratio for that group out of ratio. So even for the simple thing of going to the restroom, they need to call up front, call somebody to come in, have another staff person cover that classroom for that bathroom break, lunch break, appointments when they're sick. And also during the time that you provide much needed vacation time, you're obviously paying that staff person to not be there and yet another person to, of course, be there. A lot of us in the work that we do, if you're sitting there in an office, most of the time you work really, really hard the week before you go on vacation. And then, of course, nothing gets done while you're gone. And then when you get back, everything that was piled up, you have to catch up on the week. That doesn't exist in early child care. We can't do that. We have to have people in place. And so since it is a very heavy employee-based process, those types of things have impacted the amount of cost as well as the amount of pay. What we've been doing is really focusing on trying to help that revenue come in. In my role in the legislative body, it was asked on some of these questions about the purchase of care reimbursement rates. And purchase of care, for those that don't understand, is the subsidy that's paid for lower income families. And the way that it is done is that the federal government provides funding, the states have funding, which is almost a dollar for dollar match is what it usually ends up being, what is done. And then there is what's called, to determine the rate, a market survey. Well, that market survey is part of the problem, because what's happening is that that survey goes out to providers for them to answer what their current rates are, and then it's compiled, and then they pick the 75th percentile out of that to be the ongoing market rate that we base it off of. But even though the federal government recommends that every state pay at that 75th percentile rate, each state has the ability to pick the rate that they're going to pay. So Delaware, because of just funding issues and in the past, and this gets confusing, pays 65% of that 75th percentile. So once you start going down, we're not paying dollar for dollar, we're paying even less than 65 cents for the dollar for that. The other problem is that if you are a provider who is in an area that can charge much higher rates, and you don't take these purchase of care students, then there really is no incentive for you to fill out that survey. Why would you? You're not participating. So their data doesn't get compiled, and so those higher rates are not factored in. And then by the time you sit there and say, okay, with Delaware's budget, it wasn't until just last year that we were able to move the provider rate from a 2011, mind you, 2011 rate to the 2018 survey rate to where they should have been. And so even now today, we're still 2 years behind. We're also still at that 65%. And we all wonder why specifically there is a shortage of spaces available for low-income families. And while this isn't technically related to the topic of the industry, we obviously are in a crazy time in our society right now where we're talking about equality and opportunities and racism and that issue. Well, it's all about access. It's about access to quality care that you should not have as a child a barrier because of what economic situation you were born into. We all don't ask and want sometimes the parents that we have. We didn't pick them, and a lot of the issues that are facing children are clearly not things that they are able to pick and choose. So the dilemma that we have to have from a purchase of care standpoint, in addition to the overall industry, is to continue to advocate for the increased funding towards it, because it's that balancing act. And I've put up, and you'll see a slide, because talking about the state of the industry, it shows in 2018 that there were 460 centers, and then the home providers, 676. And as you go through the years, you'll start to see that those numbers decline. And one of the problems that exists, and this number, especially with the home situation, was much higher even in the past. The reason that has changed and why there's a significant reduction in the homes is because of the change in the qualifications that were put in place for individuals to become providers. Great thing, you're improving quality, but then if you sit there and make it to where it's a challenge and we have a reduction in spaces available with no plan of action to deal with that, we're obviously headed towards a situation. Because the other question that I had was talking about, with everything going on, do we see where perhaps the small providers, or are we going to go to large chains or bigger centers? And the answer to that is absolutely yes, because you're falling out of the ability to meet the revenue that you need to just obviously sit there and make a living and pay people. Because when you think about the home providers, these are the true heroes and champions talking about a workday. They're usually one individual, and every day they're working at least 11 hours, 11 and a half hours a day. That's what they have to do in their own in-home business. And when you made the requirements challenging, and then you look at what they actually are able to bring home at the end of the day, there were many more opportunities that they could, of course, go out and make more money. And so we as a state definitely need to continue looking at how we're going to fund, support, and make sure that these programs not only continue to exist for people to have jobs, but how can we maintain the quality? And I will just ask everyone, and this is what I say to everybody, advocacy is the key. One of the things that we saw down in Dover last year when we were dealing with the budget is we had different groups coming down. And then I'll wrap up my comments with this statement and request from you. We had groups coming down advocating for themselves. Two main groups, which I felt is actually shameful that they are having to advocate like this. One is the early child care provider community, and the other is the disability community, where they have individuals come into homes, usually dealing with adult individuals that have disabilities that can't handle themselves or medical reasons. And ultimately, both groups, when you talk about what they're needing to do for their qualifications, they're caring for individuals. They're required to go out and have certain classes, continue education, medication certification, CPR, first aid, all the basic same things. And they're also about right in the same area of pay. And yet they're having to come down to advocate. But the big difference was the group for the disability community, because predominantly it was the parents of the adult disabled individuals. They were down there in droves, obviously advocating. The early child community, while DAYC and other people definitely came down to advocate, the main providers could not be there. And that's the problem, because obviously they're there doing their job. But we need to make sure that we're out talking, that we're constantly showing that this is an important industry, that we need the additional funding. We should not be competing with one another in different groups. And that's why I have done a initiative through the Department of Health and Social Services to definitely look at the rate methodology, how it's determined, make sure we're staying consistent, and trying to, of course, advance us further with future funding. And that is going to be the key of how this industry is able to survive.
Great. Quinn, thank you very much. Appreciate all that. Let's roll to some questions, and thank you both for a very thoughtful presentation. So Cheryl, first turning to you. So some folks don't have an opportunity to work remotely. If you work in a restaurant, you work in a manufacturing plant, you work at a hospital, or you're a first responder. There's a lot of jobs out there, and there's a lot of employers where working remotely just simply is not an option. So restaurants, retail, things of that nature. So this is really critical from an employer perspective. What kinds of things have you heard, maybe anecdotally or maybe trends, that employers are starting to do to address some of these shortages, the ones that existed before, but now maybe the problems are exacerbated? What's out there? What's coming?
Thanks, Mike. That's part of the reason. Unfortunately, I don't think I have a great answer for you right now. It's part of the reason that we're in the field with the survey work, is really to understand and quickly, this is not, something that's going to go on for months and months, is to really understand quickly how the employer community is handling it. What we know and what we're hearing, at least thus far, is there's so many return to work issues, and the employer community, as I'm sure you can attest, is dealing with so much right now and just trying to figure out how to return to work and deal with the pandemic. And so I think that it's starting to, it is starting to dawn on people, right? Like, this is a really, really important issue, and we're starting to hear it, and it's continuing to bubble up. Is like, oh, wait a second, what am I going to do? I can't get people to come back if not, and it's not just childcare, although that's the focus of this conversation, but it's really school age kids, right? I mean, we're going to have this not just in childcare, but as we think about returning to school in the fall in some sort of hybrid model, likely, like employers are going to need to be flexible to the extent they're able. As you said, you can't do your work from home. And so, and employers are not in the business of childcare. And it's part of what if we've done this work over the last 4 or 5 years, is to say, like, what are the tools that employers need to support childcare and to support their working parents, whether it's additional benefits, whether it's backup care. Maybe it is an on-site childcare provider if you're a big enough employer and you can invest in that and you can support that. But that's not going to be the answer for everybody. And so I think one of the first steps is this advocacy piece, right? Is really, like, you are really extraordinary, Mike, and seeing the Delaware Chamber to step up and say, this is important. It's important to our members, and we're gonna get active on it is I think, a really important first step anyway.
Appreciate that. Thank you. Representative Johnson, let me ask you basically the same question. What kinds of innovative things do you think are on the horizon? What are some of the opportunities that we have in Delaware? I think as I sit here at 12th and Orange Streets here in downtown Wilmington, prior to the middle of March, we had a little bit in excess of 2 million square feet of open office space, and one has to wonder, if more people in a lot of the tall buildings down here don't return to work and they do decide to work from home, does that create an opportunity with all that space for employers to be incentivized to find a business like yours or help people bring care to the place of employment to make it more convenient for employees? What are some things from your perspective that might be innovative and smart that we could try?
Sure. Well, I think that's a good point. Yes, businesses also, not only the government, need to recognize, which I think that they are, the importance of early child care for multiple reasons, not only for their employee-employer relationships, but then what it does produce for the future. So I think if businesses can take a look, and even if they can perhaps group together some of the larger employers, especially in, say, the city environments, where clearly you've got big employers next to each other that ultimately they may not be able to do individually, but if they got together, they could. One of the conversations that we've always had, especially within the city of Wilmington, it seems like people sit there and often scratch their heads to say, why is there a lack of availability for specifically the low-income providers or the low-income families? And I said, to me, as a business operator, it's a no-brainer. The amount that's being paid for a slot is just not enough. And if it was enough, then you would see a provider go in there, because there definitely is demand, and that's the key. So from a business standpoint, the challenge in the state, we are pretty strapped from a financial standpoint, that unless an added revenue stream is created in Delaware, which we all know what revenue stream means, it means a new tax of some sort, that unless that's created, there's very little bandwidth in our current budget system to be able to do a lot more in additional state funding. So, and that takes time to navigate through. So if businesses really want to step up now, if they have the means, they too could look at subsidizing some for their employees.
Appreciate that. Lisa Peel had mentioned, Dr. Lisa Peel from Del Tech, our sponsor today, talked a little bit about the programs that they have at the community college for training people to work in this sector. Cheryl, back to you. How fast do you think, some of these businesses, how fast do you think the void could be filled? Is there any data that you guys looked at the U.S. Chamber Foundation that identified, yes, there's a number of these businesses that are not going to reopen? What do you see? Were there any insights from the data that suggest there's a pipeline either of talent, people that can fill the professional roles, but the businesses that will kind of step in to eventually kind of even this out? Are we looking at a 5-year deficit? Are we looking at something that's going to be with us for the better part of a year? Something in between, shorter? What did the data tell us anything?
I think it's a little bit hard to tell right now because there is this situation of like we have very high unemployment right now, and so we have a lot of people at home and not working, and so are they going back to work? You know, are they not going back to work? Are they home now with their kids and able to take care of them because they're in this situation where they're unemployed? So it's a little bit, I think we're in a little bit of murky water, so it's not entirely clear. I will say it seems, from what we've seen, is that sort of home care providers maybe are in a better position to sort of, open quickly or, to fill some of this void. But I think, what people are really, I think it's a little bit short-sighted on the part of, sort of policymakers, at least around here, is sort of thinking about like, how do we respond to the current need, right? Like this is like a COVID response, we gotta send a bunch of money in. But I think what the representative has said is really important, like this issue of reimbursement rates and some very like sort of systemic issues around this childcare system that we have are things that we really need to be thinking about in a more long-term and comprehensive way. And the only, sort of bright spot I would say in all of this is to say that the spotlight is on this industry in a way that I think is wonderful, right? I mean, unfortunately, for of really challenging circumstances and really unfortunate reasons, but I think it's going to provide the attention that the sector needs, that it deserves. I think that people haven't understood the critical nature of it until now. They haven't properly paid attention to it. They don't necessarily understand it in terms of, policymakers at the federal level. And I think now, the immediate response, again, might be more about like cash into the system or, tax benefits to families in order to help pay for it and things like that. But then we need to have a real serious question about how do we get more providers into the system? How do we have more quality care and slots available to everybody? And I think it's just, I would just say amen to what you said about equity and opportunity. I mean, this is foundational, and we know that the kiddos who probably have least access to quality care at a young age are low income minority populations. And when we look at third grade reading, we know what that indicates for further success. And it just feels like if we could just get this piece right, we could set ourselves on such a, an upward trajectory and sort of set everybody up for success going forward. And it's such an opportunity, an issue of opportunity and equality, frankly.
Thank you. In that same regard, Quinn, let me go back to you. Margie Pruitt, and Margie, I'm sorry, I don't know if that's Margie or Margie, but from the Rotary Club of Wilmington asked a question, and she said, what can be done to increase the care, the reimbursement, the POC reimbursement, so that child care centers can attract and retain their skilled and educated workforce? What more can be done? Is it just is it an hourly wage issue? Is it what's the right solution for people that are in the profession?
Yeah. So to me, I've often felt and continue to feel that the actual market survey that the POC rate is based off of has just been a slightly flawed because of the data that it collects and what it's basing off of. And while I wish I could say that everything of what the rate that is being charged in the community is a true cost of doing business, often it's not, and they don't quantify always as a provider why they should be charging the rates that they charge. That's why I've been pushing for and continuing to work on doing it from a cost analysis basis, where we really take a look and set goals to say, okay, if we obviously wish for these individuals to be equitable regarding, say, for example, there is really, in my mind, no reason why and I'll just use this as an example because I think they all should be the same, but a 4-year-old preschool teacher should be making the same amount as a kindergarten teacher in the public school system, but there is a huge divide in that level. So if we do the cost analysis and we say we want all early child care providers to make X, that needs to be part of that cost analysis, which will then tell us these are then the rate of reimbursements we need to be able to provide to achieve those objectives. And so that's what we're currently working on to move to that. But then at the same day, every legislative cycle, because of the budget cycle, it just needs renewed, continued advocacy, ultimately, because unfortunately, that's why it's a shame to sit there and actually think we had a system in place. It was supposed to be something that was followed, but yet if you don't change the survey year in which you're providing a reimbursement for, then clearly you're still stuck in the past, which is that issue I mentioned earlier about having to move everybody from a 2011 rate survey when it was 2018. That's what we were paying people on. And actually we didn't get that done until 2019. So advocacy, push for increased funding mechanisms, and do a cost analysis instead of a survey.
Thank you very much. Thank you. Cheryl, back to you for a second. You looked at when you did your nationwide survey, and you did put data up from different states, Idaho, Iowa, Mississippi, and Pennsylvania, and thank you for that. Did you see, were there any, and I think maybe you alluded to this, did you see that closures were clustered in either urban areas, rural areas, or were some of the challenges that we're going to encounter here? Is it kind of are there any common denominators, or is the problem kind of equally dispersed?
Well, and I should be clear, and I probably wasn't when I talked about this earlier, is those economic reports were done pre-COVID. So this was, sort of looking at what does the sector look like before we've, sort of entered into this period of massive closures of providers. But I will say, and there's data around this that I didn't include, but could easily be accessed and shared, is what is what we sort of term childcare deserts look like across the country, which there are many. So that is, places where there just isn't access to enough slots or any really at all. And so, that tends to be oftentimes in rural areas, but not entirely. And I'm sure that they exist in Delaware too. Again, we're going to learn a lot more with this work that we have in the field now, and would love to survey your employers and survey your parents in some of this as well, and include Delaware data if it's useful to you guys, for sure.
It would be, and you and I will follow up on that. And yes, I think that's something we'd like to participate with. Representative Johnson, let me ask you, as a provider, some of this is confidence related. We know that as consumers, there's some questions about how comfortable we're going to be going out, mixing around with other folks in kind of where we're at. We're seeing news reports come out of Florida and Texas and Arizona, parts of California, where there seems to be a second wave of the virus emerging. So some people will be personally more conservative, other people will not, and I'm not making a value judgment. So, but if you're a parent, and from your perspective as a practitioner, kids are kids, and I'm a parent of 3 myself, and all college age, but for folks that are availing themselves to your services and similar, boy, how do you keep toddlers social distanced? How do you what are some of the precautionary measures that you can do? What are some of the plans? Because I think some of this is kind of confidence driven.
Yeah, exactly. And the long story short is that there's no way to keep toddlers socially distanced. I mean, you can obviously try to explain to them, but they obviously don't know what's going on. So a lot of the measures that have been put in place in Delaware definitely also understands that. That's why there's been limits to the actual group size, to the total number of kids in a room. There's also been where we have worked to keep them, the groups separated, whereas before you may have been combining classrooms, especially in the morning and evenings as, pickup times occur. That's trying to be eliminated. You also, of course, still have, the screening, the cleaning, the washing the hands, all those protocols existed before. But it's no secret that the child care environment often gets blamed for illnesses because that's also the time period in human development when the immune system is developing. And so it's a natural situation, which is unfortunate, but I, because of my children going through it, yes, we had a lot of illnesses when they were little, but then as soon as they entered into the public school system, they were like iron horses. I mean, they were never getting sick. And sadly for our immune system, the only way to build it up is to get sick. So, and to be exposed to those types of things. So I definitely understand that every parent is going to look at this situation and the risks differently, especially depending upon their home life. If they have a grandparent living with them, etc. That's definitely going to be directing perhaps some of their future decisions, because it's virtually impossible, in my view, to sit there and say that we could make sure that the virus doesn't come into a program. To me, it's inevitable. You can make all the best, and it probably already has. Obviously, children and younger individuals seem to be the majority asymptomatic without even knowing it. So it's just being diligent, cleaning, following those protocols, and assuring parents that we're doing everything that we can to keep them and their children safe.
Appreciate that. Thank you. So as we wrap up here, let me thank Cheryl and Quinn for their thoughtful comments and presentations here today. I want to remind everybody we're going to go to closing remarks here in just a moment. We'll go to Representative Johnson first, and then to Cheryl Oldham from the U.S. Chamber of Commerce second. But wanted to remind everybody that on July 21st, we've got a virtual conference that we're going to address a whole bunch of different topics about putting Delawareans back to work. And we'd like you to join on as a sponsor or participant, and you can see the registration site below on that slide. Let me also, again, thank Dr. Lisa Peel and our friends at Delaware Technical Community College for their sponsorship here today and for all of their efforts in training today's child care workers and teachers. And with that, let's take 30 seconds. And Quinn, is there something that you'd like to say in closing as we wrap up here today?
Yep, just real quick, in the sense of quality. Quality is very important, but as policymakers are out there, they need to understand the impacts of that quality increase. For example, one of the things that the industry now faces, we elevate the teachers in their education, then to have them in August picked up by the school districts. And then we seem to go through that cycle. So we need to make sure that the policies that are put in place are going to be backed up by the support. And that advocacy is the only way that will ensure it happens. Appreciate
that. Thank you for all that you do, you and your wife in your business, and for all of your service in representing the good folks in Middletown. Cheryl, thank you. Thank you for joining us. Quite truthfully, I had heard a little bit about this subject, and then when I sat in on a conference call and you made your presentation to people like me from around the different states, and I saw your information in the slides and the research that you had done, I was dutifully impressed, and I thought, boy, this just absolutely, is a topic that we have to get on. And so thank you for the work you did personally, and the leadership of the U.S. Chamber for taking on. This is a tough topic. So any closing thoughts from your perspective here as we close out?
Yeah, I would just say thank you. Thank you so much for recognizing it as an issue and realizing that the business community has a really important role to play here. We got involved in this business because the bulk of the conversation, at least in this town, was around universal pre-K. So what are we doing for 4-year-olds in particular, and sort of And we said, wait a second, like this is not just a 4-year-old issue. If we think we can just add 4-year-olds to an existing school system and we're gonna be able to get them prepared and ready and on track for success throughout, like that's crazy. It is education from the moment that child is born. And access to, childcare is an important educational setting, but then also a really important work support. But we know, because we work with the business community all day long, in particular with state and local chambers across the country, that when the business community gets active around these education issues, it can be really, really, it can move the needle. And so we are committed to continuing to do this work. We'd love to do more with you guys in Delaware. We're here for the long haul, and any way we can be helpful, please call on us. Thanks so much for having me.
Thanks very much. So thank you both. Let me thank my colleagues for helping produce all this. Again, Cheryl and Quinn, our gratitude to you both for spending part of your day with us. This video webinar will be put on our website and it'll be probably ready and up later sometime today. And so you'll be able to refer back to it. We'll have Cheryl's slides and the slide that Representative Johnson prepared as well. And that'll be there. And again, if you are a member of the media and you want to reach out to either of them, our colleague Kelly will certainly assist in that making that connection. So again, thank you both. Thanks for everybody who listened in today. Be safe, and we will be at it again and look for other great upcoming events at dscc.com. Thank you all and have a great day.